Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe. And today my special guest is Dr. David Shafer. He is a double board certified plastic surgeon from New York. He is a diplomat of the American Board of Plastic Surgery and a member of the American Society of Plastic Surgeons. He has been featured in many publications, including W Magazine, Shape Magazine, Men's Health, Plastic Surgeon News, and the Plastic Surgery Channel, amongst others. So we are very excited to learn what is new in plastic and cosmetic surgery from Dr. Shafer. Welcome to the show.
Thank you, Neil. It's great to talk to you today.
Well, let's just get right into it and tell me what you have done in plastic surgery. How did you get started? And tell me a little bit more about your education.
Sure. So, many people are confused about exactly what a plastic surgeon is. But a plastic surgeon can have many different specialties, anything from reconstructive to cosmetic surgery. My focus is cosmetic surgery, and the way I got there was first you go to medical school, so you become a doctor. Then you do general surgery training, which is training in all the different surgical specialties. And then from there, you subspecialize. So I did a residency at Mayo Clinic in plastic surgery training. And then after that, doctors can either go into practice or they can continue training. So I decided to do a cosmetic surgery fellowship in New York City. And so that's how I ended up in New York. And then I opened up a private practice. So right after graduating, I opened a practice and then started operating and injecting and doing all kinds of procedures. And part of what I like to do is keep on the cutting edge of everything. So I'm constantly innovating and finding new procedures and following trends and seeing what patients want to have done.
Now, let's get this misconception out of the way right at the start. You're a double board certified plastic surgeon, which means you've done a lot of study and a lot of education, but it's not necessarily like that in the whole cosmetic surgeon industry, is it?
No, and you have to be careful. So when you're looking for a doctor, if they're providing a cosmetic surgery service, you want to ask them what their credentials are. So board certification is primarily the best thing you can look for, and you want to make sure they're certified by the American Board of Plastic Surgeons, because there's other kind of what I'd say fake boards out there, like aesthetic surgery or cosmetic medicine, aesthetic medicine, and those are people who may be a doctor or may not be a doctor, but they kind of have a weekend course and learning something and then put their shingle up calling themselves a cosmetic surgeon or plastic surgeon. But you want to make sure you're seeing a true plastic surgeon when you see them. Those are the people who have gone through that training that I outlined a few minutes ago, have taken the rigorous boards and follow ethical standards and safety guidelines to make sure patients are getting quality care.
So number one piece of advice there is make sure that you're seeing a qualified person, especially when you're getting anything injected into your body or cut anywhere. I would definitely want to be seeing a specialist. So speaking of a specialist, what have you specialized in your career?
So basically, the fellowship I did was aesthetic surgery. And what that is the cosmetic surgery aspect of plastic surgery. So in part of my training, when I did burn reconstruction, breast reconstruction, that's the reconstruction aspect of it. And then there's the cosmetic aspect of it, which people are familiar with, such as breast implants, liposuction, facelift. One of their big specialties is what we call mommy makeover. So you do a tummy tuck or liposuction and then some sort of breast rejuvenation depending on the patient's anatomy, such as breast lift or breast implants. And then in older patients, one of the specialties is facelift and eyelids, because as you age, gravity takes effect on your face, and just rejuvenating the skin and freshening up around the eyes can make a really nice difference for patients. The other half of what I do is the non-invasive procedures. So I just talked about all the surgical procedures, but non-invasive procedures, especially over the last 10 years or so, have really come to the forefront. And those are things that people have heard about, such as Botox or dermal fillers, such as Juvederm or Voluma, which can help lift the cheeks and and give a nice appearance to the patient without having to undergo a surgical procedure.
Now, plastic surgery, just like you said, over the last 10 years, a lot of things have come to the forefront. What is causing this major increase in plastic surgery right now?
Yeah, you know, one of the things is just the availability of it. There's more people doing it, and that goes back to finding somebody who's qualified to do it. But I think social media and the internet has had a huge impact. People are seeing what other people look like, what that people have, where you can take a selfie of yourself, make people really aware of what they look like, how they look from different angles, under different lighting, and allows them to save those images and review them later. And then they come into the office and say, I don't like how I looked here. I like how I look here. I like how this person looks. So having the digital and social media growth, I think, has paralleled the growth of plastic surgery and cosmetic surgery.
Yeah, because it wasn't as popular as it is now many years ago. What are some of the psychological reasons maybe that the social media impact are having on one's mind?
You know, people see what their friends look like, or people what they admire look like, and see how people age over time. And they spend time looking in the mirror themselves, and you know, they're processing the whole concept of aging and how they change as they grow, and they want to feel look on the outside how they feel on the inside. And sometimes when somebody looks in the mirror, looks at a picture of themselves, they say, "Hey, that's not how I feel on the inside. I want to look better on the outside as well."
Now, as far as plastic surgery being maybe viewed as a quick fix, when you think about liposuction, you know, is this just a quick fix rather than going to the gym and trying to work out or diet and lose weight?
You know, I always tell people that it all goes hand in hand. So if you think about different things you can do to improve your appearance and your health, you have to have a good diet, you have to have exercise. But there's other things, no matter how much you exercise, you're not going to see improvement. And that's where plastic surgery comes in to play. One great example is a woman after she's had babies, the muscles of her stomach have been stretched out, and the fibers that connect those muscles together, no matter how much exercise you do, you're always going to have a roundness to the belly and some stretch marks in the skin. And so you can work out to lose weight and strengthen the muscles, but you'll never get that shape that you could achieve if you do an abdominoplasty or what people call a tummy tuck, to tighten up the skin and tighten those muscles. So your belly always has a flat appearance to it.
Okay, so let's choose one area of plastic surgery that you see a lot of problems with, a lot of people come to your office and, you know, you help them with. What area would you say is most popular in your practice?
I mean, one of the main areas that people come in for, especially in younger patients, is for liposuction. People have everybody has a different shape to their body and size to their body, and you know, many people are health conscious. They go to the gym, they try to work out, but there's those stubborn areas that I call genetic fat, and so whether it's under your chin or your love handles or your lower back or your belly, around your knees, there's different areas and different places that people have trouble. So liposuction is a great treatment for patients where you can have a very quick surgery, a short recovery, and kind of have the shape that you've been working for, which you couldn't achieve with working out. One issue we do see, though, is if you do go to an unqualified person, or some people do what we call medical tourism, and they'll go to, let's say, a third world country to try to save money on surgery and have liposuction. And you can have, even though it's a safe procedure, when you're going to places that aren't qualified or aren't equipped for it, you can have problems. So one of the things I see are people who need what we call secondary liposuction. So they've had an issue somewhere else and they come to me to try to fix it.
So walk me through the process. If somebody finds out about you, Dr. Shafer, either from your website or from a referral, and they're looking for liposuction, what kind of questions are they asking when they get in contact with you?
Yeah, I mean, the process starts with contacting our office, and patients either contact us through calling us, through our web portal, or they might even send us a picture and say, "Hey, do you think I'm a good candidate?" Another way people find us is also through word of mouth, and those are actually a great way to find a doctor, because if let's say somebody had surgery with me and they were happy, they tell their friends, and then their friends come in. But you always have to individualize and customize the procedure and the surgical plan for the patient. So the first thing we do is schedule a patient for a consultation. And in that consultation process, we'll review the patient's medical history, make sure that they're healthy for surgery, that there's no contraindications, and then we'll examine their body and see what areas they're concerned about. And then we'll talk about the options that they have. Some people come in thinking that they want liposuction, but really they need a tummy tuck, or they think they need some other procedure, but they're not a good candidate for it. So we basically develop a plan for them and then talk about all their options for the procedure. After we discuss with them what procedure, and if they decide what procedure they're going to have, we can schedule a surgery date. And we always set an appointment for the patients to see us one more time before the surgery, because naturally they're going to have more questions, concerns, things they want to talk about before the surgery. And so we'll see them a couple days before the planned surgery, and then have the patient will come on the scheduled surgery date, and we'll do the surgery.
So you talked about some of the contraindications that might prevent somebody from having a surgery. What might some of them be?
First and foremost, we have to make sure the patient's realistic. There's a condition called body dysmorphic disorder, and that's where patients look in the mirror and they don't see reality, or they don't see what other people see. So they may be very thin, but they look in the mirror and to them they're seeing a fat person or a heavy person. And, there's things that when we were talking about to a patient about the procedures they want or things that they want to have done, if they don't seem realistic, or if they don't seem that what we're seeing matches reality, then we may want to encourage them to seek counseling or other avenues instead of doing surgery. Because in a patient like that, doing surgery would not solve the psychological issues that they're having. So that's one issue. And then there's medical issues. Let's say a patient has a bleeding disorder or has heart issues or lung issues, then those are things that you would want to make sure are corrected before you do an elective plastic surgery. So one of the important things in planning the surgery is scheduling a patient for what we call medical clearance. And we have medical doctors that we work with that will do a physical examination on the patient, check their laboratory values, and make sure that they're healthy to undergo the elective surgical procedure.
And as far as the procedure goes, is it for a liposuction, is it invasive? How much time does it take for the actual surgery, and what kind of recovery are we talking about?
Sure. Liposuction can vary from very minimal to a large surgery, and it really depends on the area of the body you're having treated, how many areas you want to have treated at one time, and how much fat needs to be taken out. So I could have a very common example that I have is a model here in New York City, and they have just a small little area of fat that they want removed so that they have a better contour, let's say around their knee or their inner thigh area. That could be a procedure that we do, very minimally invasive, even awake sometimes, and the patient can go right back to their same activities the next day. Contrast that with another patient who wants their thighs, their abdomen, their back, their arms. And that can be a considerable surgery to do liposuction on all those areas. And so depending on the patient, what type of work they do, what kind of recovery environment they have, then we can try to estimate for them, how intense the recovery is going to be for them.
Okay, let's move on to a different topic here. And in your notes that you gave me, we talk about you launching the Vectra XT 3D imaging system. What is that, and what does it do?
Yeah, it kind of goes hand in hand with what I was talking about earlier, where patients are more aware of their image. They're seeing themselves from different angles, from pictures they take on their phone. But what the Vectra 3D imaging does is a system we have in our office, and it takes 6 high-definition pictures of the patient and then merges them into a 3D image that we can see on the large screen in the office, and then we can show the patients possibilities of how they can look after surgery. And that's one of the ways we can gauge whether the patient's being realistic about the results they want. But we can also show them what's possible, because they may not have known what we could do. The best procedure that is for breast augmentation. Because before, when a patient wanted breast implants, you could give them the sample size implants. They could try them in their bra and see how they look. But it was really hard for the patient to imagine how it would look on their own body. But now we can take a picture of their torso and then put the actual 3D dimensions of different size implants into their body and show them what they'll look like. And it's a great way for us to have a discussion and figure out which implant size, shape is best for that patient. And there's a very high correlation between what we can show them on the screen and what we can achieve in the operating room.
So talk to me about breast augmentation for a minute. Just how has it changed over the years as far as some of the procedures that you do now, as well as some of the implants and products that you use?
Sure. When implants first came out, it was basically just a bag of silicone, which was placed under the skin. And of course, you didn't get optimal results. But over the last 20 years or so, implants have been perfected. There's different types of silicone. And the most common one now, which you hear about, is called the quote-unquote gummy bear implant. And so instead of being a liquid silicone, it's a cohesive silicone. And the texture is similar to a gummy bear. So if you broke a gummy bear in half, you'd have two pieces. Whereas if you broke one of the older style implants in half, it would be like a liquidy syrup coming out of it. So because of the cohesivity of the silicone, they're able to make shaped implants now. So natural breast isn't perfectly round, but has more of a teardrop shape to it. So we use these gummy bear implants, or the more specific name for it are anatomically shaped implants, which have what we call the footprint, which is the shape of the implant. It can have a height, a width, and it can also have the projection. So there's so many factors that go into the size and shape of an implant. And that's what makes the 3D imaging very important, so that you can customize the size and shape for the patient and make sure you're getting the exact fit for what you're trying to achieve.
Now, if somebody is coming in for breast augmentation, what do they need to know as far as the safety? And do they last forever, for their whole life?
Yeah, one misconception, people come in and they say, I've had my breast implants for 10 years, it's time to switch them out. And I always tell the patients, breast implants aren't like tires. You don't go 10,000 miles and then have to rotate them or get new tires. But there are some things that can happen with the implants, such as rupture or leaking. And that's why after surgery, it's important to monitor the patient. However, it's very rare for these things to occur, but you need to be aware of signs to look for. We're now on the 4th and 5th generation of implants. So the shell and the silicone, which I just discussed, are very high quality. And so the risk of the surgery keep going down and down as new advancements are made.
What kind of problem or situation would cause one of the implants to leak?
You know, one of the most common causes is if a patient's involved in a trauma. So I tell them, let's say you're in a motor vehicle accident and you have, considerable trauma to your body. You may also have trauma to the implant, and that could be detected when they're scanning you, looking for other injuries in your body, because there's an external force that happens to it. But, day-to-day activity and normal activity isn't going to cause these types of issues. But, it's important for patients to monitor their breast. If there's any size and shape or sensation, we have them come to the office and see how they're doing. One other issue that can happen with breast implants is called capsular contracture, and that's where your body makes scar tissue around the implant. And ways to prevent that are, again, having your surgery done in a quality control setting to prevent infection, refraining from smoking, and then having the newer generation of implants, because all of those are going to help prevent the development of the scar tissue.
Well, let's talk a little bit more about you and what made you get into the plastic surgery and cosmetic surgery industry in the first place.
Yeah, when I was a young child, I would stay home when I was sick and stay with my grandmother. And she was a nurse in World War II, and she'd always talk about being a doctor and working in the operating room. And I always found that very fascinating. And she had these, historical surgical instruments that I would play with. And one of her hobbies also was to sew. And so when I was with her, sometimes we'd do sewing projects and looking at the shape and configuration of how things can be put together. And then when I was going through high school, I always enjoyed my architecture classes, drafting classes, art classes, but at the same time, excelled in my science classes. And so when you look at medicine and plastic surgery in particular, you're combining the science, but you're also combining art and technical and dexterity skills in forming the final project. And as I was going through my general surgery training, I really enjoyed operating, but part of what I really enjoyed was the final result. So how the patient looked at the end, their incision. We always joked when we were doing general surgery, you could do a big intra-abdominal surgery and then close the incision. And the main concern of the patient was what the incision looks like, not necessarily what happened to their intestines or how the surgery was involved intra-abdominally, but they wanted to know what they'd look like at the end. And so
that does seem to be a very common concern is, what's the scar going to look like in the end?
Yeah, more so than the underlying surgery. And so when I was going through my training, I really took care and time in perfecting how the incision would look, because I knew that that's what the patient would focus on. So, as plastic surgeons, it's the final appearance is what's important to us in maximizing the result.
Oh, it sounds like you just, with everything, all your experiences growing up and, all those different things that you found yourself really good at, it seems like you really have the art for being a plastic surgeon. And it is more of an art, and that's where the different surgeons can differ. Would you say that?
Oh, definitely true. So, plastic surgeons, like I said, are combining art and science and function for the body, whereas other surgeons, let's say an orthopedic surgeon, their focus is mainly just going to be on the function, putting the bones together. But the plastic surgeon is how it's going to look at the end. So, depending on what you're having done, when you have reconstructive surgery, you may have the orthopedic surgeon fixing the bones, another surgeon fixing other parts of the body, and then the plastic surgeon coming in at the end to try to, fit everything together and make sure it all looks good. And then in cosmetic surgery, you're taking somebody who, necessarily doesn't have a physical issue, but might have an asymmetry or area that they want to change on their body. So you definitely need a very safe and ethical person, because you're taking a patient to the operating room for an elective procedure and, hopefully making them better in the end.
Well, we've talked about a lot of the misconceptions here and the safety issues and answered some of the questions that people have about cosmetic surgeries, but let's talk about the outcome now, which is why plastic surgery is so popular. Talk about a couple of positive experiences that come to mind. Somebody came to you with either a physical issue or maybe even a mental issue. What was that problem that they had? How were you able to solve it? And tell me the outcome. What kind of change did it make in their life?
Yeah, definitely. One recent patient comes to mind. She had 3 children over the last 5 years, and she came in and she said, "Dr. Shafer, I've dedicated the last 5 years to my children, but it's taken a huge toll on my body, and I can't stand looking in the mirror. I don't feel comfortable going to the beach. I don't feel comfortable with my husband. Is there anything that we can do to make improvements to do something for myself?" And, we did the consultation process like I discussed before, and determined that the best thing would be is what we call a mommy makeover. So we did an abdominoplasty, which is a tummy tuck, and then we did a breast lift for her, because after breastfeeding 3 children, it took a toll on her breasts and deflated them, what we call, and she developed ptosis, where the breasts start to hang down. And so in the operating room, we did the abdominoplasty, took off the extra abdominal skin, tightened up her muscles, gave her shape back to her waist, lifted the breast, put them in a nice rejuvenated and youthful position. And when she came back to the office, she gave me a hug and she said, "Dr. Shafer, you've changed my life. Now I look again on the outside how I feel on the inside." And when I hear that from patients, it's very special, because it tells me we've had a successful outcome for them.
Yeah, and it can make a huge difference as far as just the overall feeling, the productivity, and the way that you feel about yourself to go ahead and really accomplish more in life. So it must be extremely satisfying having people come back and tell you that you have really made a huge impact in their life.
Yeah, definitely. And you can see it in other subtle ways too. When they come in, I always say my favorite visit with the patient is about 3 months after surgery, because they've gone through the recovery, all the swelling is resolved, the incisions are all healed, and they come in, and you see they're dressed to another level. So they're wearing more stylish clothes. They have this, self-confidence that they didn't have before. And it really makes me happy to see them in that way, comparing it to the first time that they came into the office.
Yeah, it's a complete makeover and a complete change of not only the physical aspect, but so much more. So, Dr. Shafer, what is the best way for people to get in contact with you if they want your expert opinion and they're thinking about getting some kind of plastic surgery, cosmetic surgery done?
Sure. The most direct way is calling the office, and our number is 212-888-7770. But also sending an email is very easy as well for people at tight schedules. You can just email info at drshafer, drshafer, SHAFER.com. So info@drshafer.com. And from there, we can answer questions back and forth. You can send photographs. We can evaluate whether you're a good candidate before you come in for the consultation. But definitely coming in for the in-person consultation is the most important thing, so that we can take a look at you and make sure you're a good candidate. And if it's not something that we do, we can help you get referred to the right person, or even find a non-surgical treatment that might be good for you. We didn't talk about it too much, but we have a whole laser center here as well. So all the non-invasive procedures, laser treatments, and other things that people can do that don't involve surgery, or that you might do on a more routine basis just to maintain your appearance and results.
Excellent. Well, Dr. Shafer, really enjoyed talking with you today. If there's one thing that you would like to leave our audience with, one piece of advice if they were thinking about plastic surgery, what might that be?
The most important thing is to research the doctor and make sure you're going to a board-certified plastic surgeon, because they've gone through the testing, ethical questions, and have all the safety protocols in place.
Well, thank you very much for being my guest today, Dr. Shafer. That's drshafer.com. That's Dr. drshafer.com, or you can contact them at 212-888-7770. Again, thank you for being my guest on Business Authority Radio today.
Thank you. Have a good day.
And to our listening audience, if you like what you hear, hit that like button and share, and we'll see you next time in the show.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show, or to listen to past episodes, visit businessauthorityradio.com.